everyone. Welcome to the Center on Brain Injury Research and Training. This podcast is dedicated to highlighting programs and services that support individuals with brain injury. Each episode will feature a specific resource and the state or states where it is offered, bringing attention to the incredible work happening across our country. Our goal is to connect families, educators, and professionals with tools that make a difference. I'm your host, Melaney Grenz, and today my guest is the amazing Seth Friedman from Neuro Community Care in Wake Forest, North Carolina. Welcome, Seth.
Thank you for having me, Melaney.
It's a pleasure. Seth, tell us about Neuro Community Care and the amazing services you all provide to patients with brain injuries and other neurological disorders. And by the way, congratulations, you have been CEO at Neuro Community Care for 2 years. Seth, tell us about the amazing work you do at Neuro Community Care, otherwise known as NCC, and the services you provide to patients with brain injuries and other neurological conditions.
Yeah, NCC, we're located in North Carolina, but we serve a little over 600 clients nationally in 46 states and Puerto Rico. And what we do is we provide comprehensive case management with a focus on social determinants of health and social connection for our clients with brain injury and their caregivers. We find that social connection, community supports, helping them with resource navigation, providing respite for the caregivers, providing a lot of alternative therapies, including writing therapy, art therapy, equine therapy, really anything that will benefit their independence, really improves the quality of life and health outcomes, not only for the individual with traumatic brain injury, but their caregivers and families as well.
So your mission statement, I read on your website, to improve the quality of life and health outcomes for individuals beyond the doctor's office and the hospital, focusing on the whole person. Let's talk about your process. You're put in touch with a client, and there's the comprehensive case management. Talk to us about the assessment and then the resources and the ongoing individualized services, please.
Yeah. So when we're first referred a client, we do an extremely comprehensive assessment and discovery, really focus on the social determinants of health. These are the areas, one's non-medical life, that impact the quality of their health and impact their health directly. So some areas, for example, are your living situation. Is your house accessible to the needs you have? Is it, for a better term, is it ADA accessible based on the needs you have? Some of the clients we have that had a traumatic brain injury are also paraplegic or quadriplegic. Do they have wheelchair ramps? Do they have grab bars? Things like that really impact their health, their quality of life, as well as their caregivers. We assess everything from that, their diet, to their social activities, to the social support in their communities, to budgeting, and really try to connect them with a full group of resources that will impact all areas of their life based on the assessments.
Right. You keep mentioning the social connection, and you're so right. That's so important. And I think, over time, and certainly after COVID, I think we've lost a lot of that personal appeal. So what in your opinion motivates your clients to get out there in the community?
I can't speak what motivates them. I can say that we really push it. We find that social connection, one, is a way for them to find joy in life. They've obviously went through a traumatic experience, and we want to bring joy back into their life. But we also know through research, not of our own, but others' research, that social connection helps with both mental and physical health. It reduces depression. It makes you more active. When you have social connections, you go out and meet with people, you go on walks, you go on bike rides or modified bike rides, which really helps with the physical health. And just being around people, being outdoors, being active, really benefits the mental health. So we really advocate social connections and social capital, because eventually, we can't serve our clients forever, and they're going to need that social capital, the social resources in their community to really support them. Again, both the client and the caregiver, because many of our clients need long-term care.
Right. We always say, a traumatic brain injury affects the entire family. So wrapping around the entire family unit with your service is very, very valuable. Seth, you also mentioned that you get referrals from private organizations. And you also offer some pro bono cases. Can you speak to that, please?
Yeah, Helene Belos, which is our founder, really built this organization on quality of care and with the value that anyone that needs care will receive care through us if we can. So we have several pro bono cases throughout the country where we support individuals with traumatic brain injury, don't have workers' benefit coverage, a private organization behind them, insurance that covers them, or the resources to receive the care they need. Helene and her husband, John, really made it a core value of this organization to step up to support these families when no one else would. So we have clients, I believe, in 4 states right now where we're serving pro bono cases. And really what makes our program unique is our assessment and discovery, because again, no two clients are the same. And we have one pro bono case where they just really need help navigating the legal system to get the resources they need. And we have other bono cases that are much more hands-on and we need much more day-to-day care and support that we provide.
So you serve clients in 46 states and Puerto Rico. You also do some virtual case management. Can you speak to that, please?
Yeah, I would say the majority of our initial assessment, over 99% of our initial assessments right now are in person. But with our clients being all over the country and some in very rural areas, several hours away from any airport, we find virtual continued case management to be the most cost-effective, time-effective, resource-effective tool where we can do check-ins after that initial assessment. We can talk to both the client and the caregiver, but also the community support connections that we made. We have a network of over 200 community providers throughout the country that serve clients in their home and in their community. Because again, that in-person social connection is so important for the cost efficacy of the program. It's really important that we can both touch base with them and not break the bank.
Right. You mentioned earlier when we chatted that your partners, all 200 of them, they're highly vetted and some sophisticated training. So talk to us about the training that you provide those partners.
Yeah, we want to make sure the partners that we recommend and work with, first and foremost, have all the proper business license and insurances in place to serve our clients in the way they need. They're going in their home into really private areas of individuals' lives. And we want to make sure that they have every insurance to make sure it's the best quality care. And then we make each provider go through an extensive training that includes from everything from how you communicate with individuals with traumatic brain injury, cultural competence, suicide prevention or suicide care, safety and wellness plans. We have several modules that each provider has to complete and complete a test on before being able to work with any of our clients and families.
It's very reassuring to know that all of those partners are just well vetted. So, Seth, Neuro Community Care, tell us about your future goals.
So, as an organization, we really want to grow to serve more clients throughout the country. As I mentioned, we serve about 630 clients. The vast majority of them are military, but we do know there are other concentration of individuals that unfortunately suffer from traumatic brain injuries. First responders come to mind, police, firemen, firewomen, all are more likely to suffer traumatic brain injuries. And we have not found the resources yet to serve them in mass, but we would like to support them and their families as they suffer these injuries, as they go through these transitional periods in their life into a new normal. We want to make sure we are able to serve them, but we also want to serve private clients as we think the social capital, the social determinants of health, these social prescriptions are really the wave of the future in medical care. Everything outside of the medical office, we believe, really complement the clinical care that they're already getting. If a patient sees a mental health therapist 1 hour a week and then goes home into isolation for the other 6 days and 23 hours, the benefits they're receiving from that 1 hour are not going to stick. And so we believe the social supports, the community connections, the resource navigation, the respite for caregivers really is the comprehensive care needed to see long-term benefits for clients dealing with not only traumatic brain injury, but any complex medical condition families dealing with terminal family members, or any health challenge that has long-term ramifications.
On your website, you have an amazing quote. We don't just provide care, we foster hope, independence, and meaningful connections for those we serve. Thank you for all you do, Seth Friedman from Neuro Community Care, Wake Forest, North Carolina. On behalf of the Center on Brain Injury Research and Training, we wish NCC continued success and growth, and we sincerely wish that our paths cross again. Thank you so much.
Thank you, Melaney.